Have you ever wondered why depression, a condition affecting over 264 million people globally, remains widely misunderstood? In today's age, this is a question that leaves many baffled. It's a silent epidemic, lurking in the shadows, often unseen and unspoken about, yet its impact is as real as it gets, with a ripple effect that extends far beyond the individual, touching every aspect of life. According to the World Health Organization, depression is one of the leading causes of disability worldwide. It's a condition that transcends borders, races, and socioeconomic statuses, proving that mental health issues do not discriminate. It's a stark reminder that we are all human, susceptible to the ebbs and flows of life's complexities. Depression is not just about feeling sad or blue for a few days. It's a persistent feeling of sadness, a loss of interest in activities once enjoyed, and a constant battle with feelings of worthlessness. It's a constant struggle, a silent fight that millions face every day, often in solitude. The impact of depression extends far beyond the emotional toll it takes. It affects physical health, relationships, productivity, and even our economy. The World Health Organization estimates that depression and anxiety disorders cost the global economy $1 trillion each year in lost productivity. And yet, despite its prevalence and impact, depression remains shrouded in misconceptions and stigma. Many still view it as a sign of weakness or a character flaw rather than a legitimate health problem. This lack of understanding often leads to delayed or inadequate treatment, further exacerbating the condition. Understanding depression is not just about statistics and facts. It's about empathy and compassion. It's about recognizing the signs and symptoms, reaching out to those affected, and creating a safe space for dialogue and support. The more we understand about depression, the better equipped we are to tackle this hidden epidemic. To do so, we must shatter the stigma, dispel the myths, and foster a culture of acceptance and understanding. Depression is not just a passing mood, but a complex mental health disorder that requires our attention and understanding. So, what exactly is depression? It's a question that's often asked, yet the answer is far from simple. Depression, according to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or DSM-5, is a mental health disorder characterized by persistent feelings of sadness, hopelessness, and a lack of interest or pleasure in activities. It's not just a case of the blues or a passing bout of sadness. It's a pervasive and relentless sense of despair that can interfere with daily functioning and even lead to physical symptoms. But depression is more than just a low mood. It's a serious condition that affects both the mind and body. It can impact everything from your appetite to your sleep, energy level, concentration, daily behavior, or self-esteem. And contrary to popular belief, depression isn't a sign of weakness or something you can snap out of by picking yourself up by your bootstraps. Depression is not a one-size-fits-all illness. Everyone experiences it differently. Some might feel a constant state of sadness, while others may feel a general loss of interest in life. Some may struggle to get out of bed each morning, while others may be unable to sleep at all. Research shows that depression is a very real and significant condition. A study published in the Journal of the American Medical Association found that people with depression have higher levels of inflammation in their brains. Another study in the Archives of General Psychiatry showed that people with depression have different brain structures, with smaller frontal lobes, the area responsible for regulating mood and decision-making. So let's be clear, depression isn't just about feeling sad. It's a medical condition that affects every aspect of a person's life. It's about losing interest in things you once loved, struggling to get through the day and feeling like there's no light at the end of the tunnel. Depression is a serious condition that can severely affect a person's life, but it is also treatable with the right help. It's not a sign of weakness, it's a sign of being human, and with the right support, recovery is absolutely possible. Depression doesn't discriminate, but what causes it? Well, the onset of depression can be attributed to an intricate interplay of genetic, biological, environmental, and psychological factors. Each of these elements plays a crucial role in the development of this mental health condition. Let's begin with genetics. Just like eye color or height, our susceptibility to depression can be passed down through generations. Studies suggest that individuals with a family history of depression are 2 to 3 times more likely to develop the condition. However, not everyone with a family history of depression will experience it, indicating that genetics is not the sole determinant. Moving on to biological causes, brain chemistry and hormones significantly influence depression. Neurotransmitters, the chemical messengers of the brain, are often out of balance in people with depression. Additionally, hormonal changes can trigger depression, such as those that occur during pregnancy or menopause, or due to thyroid problems. Now let's consider environmental factors. Chronic exposure to violence, neglect, abuse, or poverty can make individuals more susceptible to depression. Life events such as the death of a loved one, a breakup, or job loss can also trigger depressive episodes. Lastly, psychological factors. People with certain personality traits are more prone to depression. This includes individuals who have low self-esteem, are overly dependent, or have a pessimistic outlook on life. Furthermore, those who have experienced traumatic events in childhood or have other mental health disorders like anxiety or post-traumatic stress disorder are at a higher risk. In the realm of research, numerous studies corroborate these relationships. For instance, a study published in the Journal of the American Medical Association found a strong link between a person's environment and their likelihood of developing depression. Another study in the Archives of General Psychiatry found that individuals with a family history of depression had a higher risk of experiencing this condition. It's worth noting that these factors do not operate in isolation. Rather, they interact in a complex way that varies from person to person. This is why two individuals may experience the same stressful event, yet only one may develop depression. Depression can be triggered by a combination of these factors, making it a complex condition to understand and treat. Depression can seem like a life sentence, but is it? Not at all. It's important to understand that depression, while a serious mental health condition, is treatable. There's a plethora of treatment options available, each tailored to the individual's needs and the severity of their condition. Let's delve into these treatment methods. First, we have medication. There are several types of antidepressants available, and they work by balancing the brain's neurotransmitters, which are involved in mood regulation. Selective serotonin reuptake inhibitors, or SSRIs, and serotonin and norepinephrine reuptake inhibitors, or SNRIs, are among the most commonly prescribed. These medications can help alleviate the symptoms of depression, and research has shown them to be effective. Next, there's psychotherapy, also known as talk therapy. This treatment method involves talking about your condition and related issues with a mental health professional. Cognitive behavioral therapy, which helps individuals identify and change negative thought patterns, and interpersonal therapy, which focuses on improving relationships that may contribute to depression, are two common forms of psychotherapy. Studies have indicated that psychotherapy can be just as effective as medication for many individuals. Lastly, lifestyle changes can play a significant role in managing depression. Regular physical activity, a healthy diet, sufficient sleep, and reducing alcohol and caffeine intake can all contribute to better mental health. Incorporating mindfulness practices like meditation and yoga can also be beneficial. Moreover, some individuals may find relief through alternative therapies such as acupuncture, massage, and herbal supplements. However, it is vital to consult with a healthcare provider before starting any alternative treatments. It's crucial to remember that treatment varies depending on the individual and the severity of their depression. What works for one person may not work for another, and it often takes time to find the right treatment or combination of treatments. With the right treatment, individuals suffering from depression can lead fulfilling and productive lives. It's not a life sentence, but a condition that can be managed with the right care and support. Depression is a complex and serious condition, but there is hope. As we have explored, depression is a hidden epidemic affecting millions globally. It's not simply feeling sad or down, it's a profound and persistent feeling of despair that can drastically affect one's quality of life. Understanding depression means acknowledging its complexity. It's not a one-size-fits-all condition. It manifests differently in everyone. The causes are multifaceted, often a combination of genetic, biological, environmental, and psychological factors. Yet it's not a life sentence. Treatment is available and effective. It can be a combination of medication, psychotherapy, lifestyle changes, and support from loved ones. The crucial part is to seek help when you need it. It's not a sign of weakness, but a step towards healing. Remember, understanding depression is the first step towards defeating it. Reach out, seek help, and let's fight this battle together.